The question is, which type high intensity interval training? Just walk, just jogging, swimming, play basketball for how long? It's a great question, and maybe we should cover that more deeply because it's a long topic. I will tell you, professional cyclists use this. Most professional athletes use one type of high-intensity interval training or another. And as you see here, I mean, some people talk about walking high intensity. It's hard to accomplish that with walking, but you can. The bottom line on high-intensity interval training is that you want to get your heart rate up, as in like the top 80 to 90% of what you're able to do. One of the things you'll see with a significant, easy way to look at that is aerobics. They'll tell you, you need to be able to hum or talk when you're doing aerobic training. You shouldn't be able to do any of that when you're doing high intensity. You need to be huffing and puffing like that. Now, how long does that take? Like I said a minute ago, the professional cyclists will do 30 seconds of intensity followed by 30 to 40 to 90 seconds of low intensity to burn off some of that lactic acid. They'll start off with 3 of those cycles, work up to 10 or more, and no more than 3 or even 2 times per week for that session. But again, if you're able to do it I have a lot of people that say, no, I just do it every day. The reality is, if you're doing it every day, either A, you're not being intense enough, or B, you're going to wear yourself out. Again, if you're pushing large muscles hard enough to where you're having to gasp for air, you don't need to be doing that 7 days a week. You just don't. Hopefully that gives you some perspective on this. One other thing I would say about exercise is that you hear about resistance training and people think weights. They think Arnold Schwarzenegger. They think big muscles. The reality is, even if you're Arnold Schwarzenegger, this is not where your muscle mass is. Your thighs and your hips and your calves. That's where your muscle mass is, and that's what we're looking for in terms of health. The upper body stuff, yes, it's important. It may be important for falls and stuff like that, but it is not as important for health as the big mass muscle groups. Those are the ones that are bypassing your insulin receptors, your failing insulin receptors, and pulling that blood sugar out of the blood where it can burn your arteries, cause problems, cause these things that we're talking about, atrial fib, heart attack, stroke, blindness, where it can cause all those things. It can't cause those things if that sugar is in the muscle. And the way you get that is you get your big muscle groups, your lower body, into major intense activities. You know, this insulin effect that happens with that type of high intensity and resistance training, it's been shown that that insulin effect will last up to 48 hours if intense enough and in big enough muscle groups. Now, when you think about 48 hours, that's an interesting thing because you go back and you look at all the research that's been done around impact of exercise, and most of it would indicate that you need at least 3 big episodes per week. And yes, you can do some other episodes with lighter work, and you should. Other times in the week, you should probably do some sort of rest at least 1 day a week. But don't try to get more than 3 big episodes each week. So I'd like to talk with you a minute about the webinar. People don't understand what the webinar is. It's actually a great way to get some access to healthcare that you're just not going to get any other way. You actually get the lab tests yourself at a local lab, a Quest lab near you, for the inflammation panel and the OGTT and the insulin survey. These are things, inflammation and prediabetes, that your doctor just does not know about. And here's the thing. Harvard Health and many others have said, look, sudden death is not always so sudden. The Hollywood picture that it's a bolt out of the blue is not realistic. It's more like real lightning, preceded by clouds, wind, and rain. Stop that metabolic storm before the lightning strikes. And here's where that metabolic storm comes from. It's inflammation, and it has to do usually with prediabetes. So again, we actually get labs, we go over them in the webinar, and then you can start finding out how you can prevent that heart attack others said that you couldn't even predict. We can show you how. Thanks.